Hi, my name's Carly Bear. I'm a student at State College of Florida in the bachelor's program from RN to BSN, and I'll be doing my basic head-to-toe assessment today, putting it all together. I have my peer here, my coworker, Rolanda Parker. Do you consent to being videotaped for this assessment, Rolanda?
Yes.
Okay. All right, so I'm just going to start, and we are at Sarasota Memorial Hospital where we both currently work, and I'll start my assessment. So before I would go into the room, I would knock on the door, enter, pull the curtain for privacy. Here. I would use hand hygiene, and we have some hand sanitizer over here. And I would come in, introduce myself. Hi, Rolanda. I'm going to be your nurse today. My name's Carly, and I'm just going to be doing a basic head-to-toe assessment for you, okay?
Okay.
All right. Can I take a look at your wristband here? I would apply gloves. And can you repeat your full name and date of birth?
Rolanda Parker, 10/19/1980.
Okay, and any allergies?
No.
Okay, perfect. And you can get comfortable if you'd like, or just sit there, whatever works for you. All right. Okay, so for the purpose of this assessment, she's not in a gown, but my patient would be in a gown, and I would be doing the assessment on skin for the cardiovascular and lung portion. So first I'm going to start by asking her just a couple questions about her alert and orient status. So do you know your full name?
Yes, Rolanda Parker.
Okay, and do you know what date it is?
June 17.
Okay, perfect. And I'm going to just raise her up for proper body mechanics as well. Do you know who the president is, Rolanda?
Barack Obama.
Okay, perfect. And do you know why you're here?
Yes.
Okay. 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 So she is alert and oriented ×4. Now, I'm going to assess her cranial nerves next. So the first cranial nerve that I'm going to assess is her 5th cranial nerve. Now, if you can I'm going to raise your head up just a little bit, okay? All right. Now, if you can close your eyes for me and tell me what parts of your face that I'm touching.
Left cheek, right cheek, forehead, chin, nose.
Okay. So her 5th cranial nerves are intact. She's able to identify where I'm touching her face. Next, I'm going to ask you to puff your cheeks out and clench your teeth. Okay, perfect. And so her 7th cranial nerve, her facial nerve is intact as well. Next, I'm going to ask you, since you're able to respond to my commands, my questions, I will assume that her 8th cranial nerve is intact as well, which is her hearing. So next, I'm going to ask you to say ah. Okay. 10th cranial nerve is intact. And can I ask you to move your head side to side like this for me? Okay, perfect. And back and forth like this. Okay, so her 11th cranial nerve is in place. And can I ask you to twist your tongue back and forth? Okay, perfect. And then just have your tongue hit the sides of your cheeks, both cheeks. Perfect. So her 12th cranial nerve is in place as well. All cranial nerves are intact that I'm assessing. Okay, so next I'm just going to take a look at her eyes. I would have a pen light for this demonstration, which Rolanda does have, which is mine. Okay, all right, I'm going to take a look at your eyes, okay? I'm just going to put your glasses right on your head. Now just look straight ahead for me, okay? I'm going to take a look at your pupils. Okay, so her pupils are dilating. Can you follow my pen for me? Just with your eyes. Okay, perfect. And let me take one more look at your eyes, please. Okay, so her pupils are about 4 millimeters in size, which is normal. They're accommodating, reactive, and Perla is completely intact for her. Now I'm just going to take a look at your ears, okay? I would have my gloves on for this. I'm just going to look. No masses, tenderness on either side, and she's able to respond to my commands, so her hearing is intact. Next, I'm going to just take a look at your mucous membranes as well. Can you say off for me? All right, and under your tongue? Okay, so her mucous membranes are pink, moist, and intact. Next, I'm gonna just take a look at her neck. Feel for any lumps, masses, tenderness. Any tenderness when I touch here, Alonda?
No.
Okay, perfect. All right, so that is intact as well. Next, I'm gonna move to her skin. She does have a jacket on, but are you able to take the jacket off for me? Okay. All right, so I'm just gonna take a look at her skin. If she had an IV, I would assess the IV site, make sure there was no phlebitis, infiltration, redness. And I'm just gonna feel her skin. Upon touch, it's warm, no moist areas, no excoriated areas. And I'm gonna look at her hydration status. She's hydrated. I'm gonna look at your nails here, look at your capillary refill. Less than 3 seconds, which is good. Okay, so everything looks good on her skin. Next, I'm gonna move to her radial pulses. So I'm just gonna take a look at your pulses here, and I would assess the radial pulses for a full minute for the purposes of this assessment. I'm not going to do that. Okay, so they feel good. They're +5 and strong, which is good. All right, so next I'm gonna just take a listen to you, okay? I'm gonna take a listen to your lung sounds.
Okay.
Both anterior and posterior. Can you take a deep breath for me? Right, so her anterior breath sounds sound good. There's no adventitious breath sounds, no wheezing, crackles. Everything sounds clear bilaterally. I'm gonna take a listen to your heart, okay? And I would listen to the apical pulse for a full minute, and her heart sounds good. All right, I'm gonna ask you just to lean forward if you can. I'm just gonna take a listen to your posterior breath sounds as well. Take a deep breath for me. Right, and as she was leaning forward, I would just take a look at her skin, make sure there's no breakdown or anything like that. And we would say that I did that, everything looks good, there's no reddened areas. You can lean back for me. All right, so next I'm gonna take a listen to your bowel sounds, okay? Just a little listen to your stomach. Have you had any tenderness or any problems with your stomach recently?
No.
When was your last bowel movement?
Yesterday.
Okay, perfect. So her bowel movement is regular and it's been pretty consistent for your norm? Okay. I'm just going to take a listen, starting in the right lower quadrant. Okay. All right, so there's bowel sounds present in all 4 quadrants. I'm going to next palpate. Can I just palpate your abdomen real quick? Is that okay? Okay. So you let me know if there's any tenderness or soreness here, okay? I don't feel any masses, any lumps, any abnormalities in her stomach. So that's good. Okay, so next I'm going to move to her lower extremities. So her lower extremities would most likely be exposed in a gown, but for the sake of her having scrubs on, I would just assess the skin underneath and the temperature of her legs. Everything feels good, warm to the touch. I don't see any discoloration in the skin. And next I'm just gonna look at your feet here, okay? I would assess her pedal pulses. And her pedal pulses are good, +5, normal quality. All right, and you have shoes on, but I would ask you to just push on my hands, against my hands, and then pull back. Perfect, and that's just assessing her her muscular strength. I'm going to do the same with up here. I'm going to ask you to squeeze my fingers as tight as you can. Okay, perfect. So her grip strengths are good, her pedal pushes are good as well. And next, I've assessed her circulation, her musculoskeletal, everything is symmetrical, everything is looking good. Next, I'm going to assess her reflexes. Okay, so for the sake of this assessment, I'm going to use a pen here. So I'm just going to, if you can just relax your arm, I'm just going to tap on your bicep here. And when I stimulate her bicep, there is a twitch, which is normal. Okay, and next I'm going to look at your brachioradial, which is here. Okay, and there's a twitch in her thumb, which is normal as well, so that is intact. Next I'm going to look at your tricep reflex back here, which there is a twitch there as well. And next I'm going to look at your knee. If you can just kind of sit up at the edge of the bed. I'm going to look at your patellar reflex here. Okay, so a little bit of movement in her feet, which is good. Her reflex is present. Okay, and next I'm just going to look at your ankle here. Okay, so her ankle clonus reflex is present, and for the purpose of this assessment, I'm not going to do her plantar, but I would stroke the bottom of her foot and see if there's any abnormalities, if there's a Babinski reflex noted, and if negative, then she would be normal in her assessment. Okay, so that's going to be it for your assessment, and thank you very much.
You're welcome.